Good morning, everyone. Live from San Antonio, Texas, this beautiful morning with Dr. Roger. And Dr. Roger, you brought someone on our live stream today.
Yes, I'm happy to introduce David Doro, who is the doctor program liaison for Direct Med Clinic. Welcome to
Hello,
LinkedIn
everyone.
Live, David.
Thank you, sir.
So
Glad to be here.
great. We were in a meeting the other day, marketing meeting, and David mentioned something that was kind of interesting, and I thought we would invite him today and talk about that. David said that health insurance was driving some people crazy. You wanna talk about that a minute, David, and what you're experiencing out there when you're talking to employers and people about what we do?
Absolutely. My job is I get out and visit with business owners and operators all day, every day. That's what I do, explaining what direct primary care is. So as I visit with these owners and operators, I keep hearing more and more my health insurance premiums are driving me crazy. And some of them are using some other words that I won't repeat.
Thank
But
you.
when I dig into that a little deeper and I inquire a little more, what do you mean by that? They're basically saying that they've always wanted to provide a benefit for their employees. But what's happening to them now, deductibles are going up, copays are going up, every year premiums are going up. And really, for the first time, because of inflation and other things in the economy, they're having trouble holding on to it. And even if they can hold on to it, more and more employees that were in the insurance program are dropping out because it's completely unaffordable under the current economic conditions. And some of those owners or operators, they're just dropping out. I visited with two companies in the last 2 weeks that they're just not going to renew their health care insurance. It's too expensive and it's maddening to them. It's driving them crazy because they can no longer provide a very valuable benefit for their companies.
Wow, I can imagine how frustrating that would be as a business owner, where you want to provide like it's called a benefit, and it's not really being used. I mean, we had another um, business owner that had over 100 people last year that looked into what we did because of that very reason. The CEO of this company told us that um, that our people weren't using the health insurance that they provided, and she was wondering why. And what did remember that, David? What did she say?
Absolutely. She actually interviewed each and every employee that was on the plan personally and questioned why, because they're a company that paid 100% of the premiums for their employees and they only had about 15% using it. And when she sat down with them, every one of them said the same exact thing. I can't afford the deductibles and the copay because most of it's out of pocket for the biggest part of the year. And we just don't have the money to do that. Therefore, they don't utilize healthcare insurance that's 100% paid for by that company. And that was very shocking to the corporate executive that actually did the interviews.
Wow. So long story short, they started talking to you more about what we do, and now they they use direct primary care in their organization, and folks have access, and so that's what you do, right, David?
Absolutely. That's what I do. I am the person visiting with those owners and finding out what their frustrations are and then figuring out a way that we can solve those frustrations, we can release some of that stress and provide quality, accessible, affordable health care for those employees and it won't drive them crazy anymore.
You know, that's one of the things that I always talk about is that uh, health insurance is not the same thing as health care. And so much in our
Exactly.
world these days, when people are talking about health care, they're really talking about health insurance because they talk about health care is so expensive. Well, no, not really. it's health insurance that's very expensive, right? And so what we provide at Direct Med Clinic through Direct Primary Care is health care. That's health care, and it is
Absolutely.
affordable, right? There's a
Absolutely.
there's a fixed fee every month, and after you pay that, you have unlimited access to us, either walk in the clinic or virtually through our app or whatever.
Yeah,
Absolutely.
it's interesting. I usually talk much more, but with David here, there is no need for it. He's the man on the ground, and it's really good to hear that. Well, it's really interesting. It's not good. It's really interesting to hear the firsthand experiences there. And I was wondering, when someone says healthcare insurance is driving me crazy, does that also have to do with the entire process of, okay, so knowing whether something is covered, we know that there is this entire deal with getting pre-approval, pre-authorization, I think it's called. And do you see, David, do you see a lot of problems with that as well, where people just lose the courage to go through that process of knowing whether they can get that scan, where they can see that specialist?
Absolutely. The company we were just referencing is a prime example. One of their complaints was that they would call in and they couldn't get an appointment for a week or 10 days. While I'm sick, I need to come in. So virtual visit wasn't an option, which we provide. And coming in to see the doctor, they couldn't. So they're just getting worse and worse, and it frustrated them. And the great thing about what Direct Primary Care does, which is what we do at Direct Med, is if you're a member, you can get a virtual visit most of the time, same day that you need it if you're ill. If you need an appointment, most of the time we're going to get you in the next day, and you're going to get in to see a practitioner through the app. You've also got access through texting through the app to the practitioners. So something in the middle of the night, something happens, you're no longer alone in your health care. You now have a group of people that are partnering with you because we want you healthy. We don't want to see you when you're terribly sick and have been sick for weeks. We want to take care of you immediately, proactively, and that's our biggest strength.
Dr. Roger, from your perspective as a physician, would you sometimes make the same or a similar statement
Oh my
about
God. When I first was exposed to Direct Primary Care, I thought, oh my gosh, how refreshing this is. This is amazing. I thought, what a way to practice. And the rest is history. I've just loved it ever since.
Mhm.
It's the way to go. It's a wonderfully refreshing way to practice medicine, to be able to just sit down and enjoy the time with your patients, give them the time they need, and right, and just practice in a way that you're focused on them, not necessarily what's going to get you reimbursed or paid.
Mhm.
So we don't have a waiting room that's packed full of people and everybody gets a 10-minute visit. So it's not that. It's what we have in our mission statement is that we restore the doctor-patient relationship.
Mhm.
That's what we do.
Absolutely.
Well, the great thing is that not only do you do that, but you are also, both of you are very accessible. So definitely reach out to David. He's easily findable on LinkedIn. Just go and search for his name, reach out to him. He has a wealth of knowledge when it comes to having the conversation, how this applies to employers. Reach out to Dr. Roger as well. You both are very approachable people, and that is something that is also not very often seen in healthcare. Furthermore, there is a ticker that is going here at the bottom, which has an address, link.directmedclinic.com/employers. And as the link says, it is for employers who are trying to understand how can this work in my company. And by the way, this is something that DirectMed Clinic can help you pretty much no matter where you are. There's always going to be a way to help you bring affordable and accessible healthcare. And in that, if you follow that link, you'll get more information on that as well. Well, perfect. Any final thoughts before we let our viewers go today?
David?
Well, mine's real simple. Don't go crazy. Don't sit up at night worrying about those things. You reach out to us and you can worry about other things. We can solve this for you.
And I would just like to make the comment I've made many, many times is when you hear somebody talking about healthcare, think for a minute. Are they really talking about health insurance? Or are they talking about healthcare?
Mm-hmm.
Exactly.
Yep, that. And then next time we will reveal the answer to that question. David, it's been fun having you on. I hope you consider doing this more often with us. It really gives a good perspective. And again, people know that there is not only Dr. Roger, but also you, whom they can turn to get help, because that's what DirectMed Clinic is all about, helping companies, employers, also individuals, but we have a huge focus on employers, help get more affordable, accessible healthcare so that we can make our communities healthier in these trying times.
Absolutely.
Absolutely. Good. It was good to be here.
Awesome. Okay, well, have a great afternoon, very soon afternoon, and the weekend is close. And then I'm sure we'll see each other here online in the coming week.
Very good.
Absolutely.
Bye.
Very good. Bye.